Huntington's is a fatal brain disorder. It is caused by a faulty gene that leads to the buildup of toxic proteins in the spine. The protein destroys nerve cells in the brain and spine, and leads to symptoms similar to Alzheimer's, Parkinson's, and ALS all at the same time. Since it is a genetic disorder, it can be inherited from parents and passed down to children. All areas of the brain are affected, but certain areas are more vulnerable than others. The disease is progressive, so it will get worse as you age. The Huntington's disease is inherited in an autosomal dominant way. A mutation in the HTT gene allows for the production of the gene Huntington. The Huntington gene is thought to aid in brain processes and is essential for normal brain development before birth. The protein aids in transportation materials and apoptosis. The HTT gene also includes a common pattern called a CAG, a type of trinucleotide repeat. The longer the mutated trinucleotide repeat is, the earlier the onset of HD will become. This disease is rarely caused by mutation in previously unaffected family lines. As you can see in the Huntington disease statistics, 97 to 99% of families already had Huntington's in their family. As also shown in the Huntington's disease graph on the right, the more trinucleotide repeats, the earlier the onset. Some rare cases can be as early as 5 to 7 years old. Diagnosis is fairly straightforward most of the time. For patients suspected of HD, gene testing can be done to discover the affected HTT gene. Family descent can also be examined for signs of HD. Repeats in the trinucleotide repeat can also be counted in gene testing to understand the severity of a specific case. Huntington's is a progressive brain disorder, so it grows more severe as you grow older. Data has shown that the younger the onset of the disease, the faster the disease progresses. The most common cause of death are aspiration pneumonia and heart failure. Huntington's usually takes 10 to 30 years for the disease to progress to full severity. Common early symptoms for Huntington's include slight changes in coordination, balance, fidgety movements, slowing or stiffness, trouble thinking through problems, and depression or irritability. Common mid-symptoms are trouble swallowing, stumbling, falling, emotional outbreaks, and dropping things, and common late symptoms are stiff or awkward walking, increased clumsiness, changes in speech, trouble learning new information, and walking is no longer possible, speaking is no longer possible, and the patient is largely dependent on caregivers. Huntington's is currently incurable and causes fatal complications in every case. There are few treatments available to lessen symptoms, however. Various medications for abnormal movements and behavior are all available, as well as antidepressants, as depression are common among affected patients. There are a handful of FDA-approved medication, such as chorea, which is for jerky and writhing movements, such as tetrabenazine. Speech therapy can also improve the use of muscles for speaking, as well as swallowing. Physical therapy can help improve jerky movements and safely teach the limits of a person suffering from Huntington's. There are many important doctors who can help aid in the care of a Huntington's patient. Clinical geneticists can conduct important gene tests. Neurologists provide important insight on brain development and function throughout the disease. Physical therapists provide aid in physical ailments that might be caused from Huntington's, and a psychiatrist can improve the mental stability of a patient. On top of the degradation of the nervous system, the muscular system is also largely affected. Shaking and spasms are all common in Huntington's patients. Walking, swallowing, and talking can also be largely affected by Huntington's. Muscles may become stiff and jerky. The digestive system and respiratory systems are also affected by Huntington's. Difficulties swallowing lead to many issues inside the lungs and stomach. The picture in the center shows the basal ganglia of the human brain, showing the impact of HD on the brain structure in this region. Especially note that the brain of a person with HD has bigger openings due to the death of nerve cells in that region.